Hello, my name is Matthew Wester. I'm an audiologist here at Mayo Clinic in Arizona, and I'm here today to talk to you about what happens when you are scheduled for testing for dizziness and balance. Your doctor may have set you up for some tests and given you some test instructions, and I wanted to talk to you a little bit today about how to prepare for those tests and what you can expect. Dizziness and balance testing in the audiology department is so that your doctors can determine whether your symptoms are coming from an ear problem or not. They're going to use this information to help come up with a diagnosis and some treatment options for your symptoms. The testing will usually last about an hour and a half to 2 hours. In the test, you'll be asked to stand on your feet for part of the test. A lot of the test is measuring your eye movements as well. And so there are some pre-test instructions that should be sent to you. And if you have any questions about that, of course, you can call your referring physician. But just briefly, there's some things that you're asked to do in regards to not wearing face makeup, wearing loose, uncomfortable clothing, avoiding certain medications, as well as avoiding certain foods and drinks. And those will all be in your test instructions. If you have any questions, please refer to those instructions. The different parts of the test that you might undergo come in different sections. In one of the tests that you may have all of those or you may have some of those depending upon what your doctor has requested. The first test that you might undergo is the posturography test, and in the posturography test you'll be asked to stand on a platform for about 20 to 30 minutes while we measure how well you are able to keep your balance. You will be wearing a safety harness, so if you do lose your balance at any time during the test, you won't be falling down, so it's not a test that you need to be worried about. Another part of the test that you may be scheduled for is the VEMP test. Now in the VEMP test, you'll be laying back in a chair with your head turned to the side. There'll be some stickers on your forehead and neck, and there'll be an earphone in your ear playing a loud click sound. You'll be asked to simply lift your head off of the headrest while the click sound plays. Another portion of the test is the video nystagmography test, and that's the test where we measure your eye movements. So in that test, you'll be sitting in a chair and wearing some goggles so we can record your eye movements. You'll be asked to follow a light from place to place, and then in another section of the test, you'll be put in some different positions, laying back, turning your head from one side to the other, rolling over from one side to the other. All the while we'll be recording your eye movements. And in the last section of the video nystagmography test, we'll put some warm and or cool water in your ears one at a time. That's the part of the test that may cause you some dizziness. It's usually not uncomfortable for most patients. Some patients who experience motion sickness easily, like if they get car sick easily or seasick easily, they may experience some nausea. And so that's one of the reasons why we ask that you refrain from eating for several hours before the test, just so you have an empty stomach. Your clinician will do everything that they can to minimize any discomfort you may have if you are a person who becomes motion intolerant very easily. Another part of the test that you might undergo is called the Rotary chair test. And in the Rotary chair test, again, we're recording your eye movements, but this time you're sitting in a chair in a small enclosure in the dark, and the chair will turn slowly from side to side. It's typically not an uncomfortable test. Perhaps for patients who have some claustrophobia, they may not find it as comfortable, but again, your clinician will do everything they can to make the test as comfortable as they can for you. So that's a brief explanation of what happens when you're set up for dizziness and balance testing and how to prepare. I hope you found this information helpful. If you have any questions, please refer to our website. Thank you very much.